Hello, I'm Daljit Dhaliwal of World Focus, and joining me now is Julia Greenberg. She is the Associate Director of AIDS Free World, a global advocacy group tackling HIV and AIDS, and she is responsible for the Caribbean region. Julia, thank you very much for joining us.
I'm delighted to be here.
So give us some background on AIDS and HIV in the Caribbean, especially in Jamaica. If you start off with that, what are the rates of infection and what are the trends that we're seeing?
Sure, I think the most important thing to know is that in the general population, the HIV prevalence rate is 1.6%. But if you look at the population of men having sex with men, the gay community, that prevalence rate soars to 31.1%.
And what is being done about trying to reach out to these groups and to try and educate them about HIV and AIDS and to come up with preventative measures?
Well, I think you have to step back when you look at the issue when it comes to men who have sex with men in Jamaica and look at the terrible culture of homophobia that is pervasive throughout the country, right? So there is a sodomy law, gay men's lives are criminalized. So in one of the segments that World Focus aired earlier this week, in fact, there was a gay man who said, AIDS is not killing us, people are killing us, referring to the very high murder rates of gay men in Jamaica.
Do you think it would make a difference if these laws around sodomy were decriminalized in Jamaica?
I think it would be part of making a difference. I think we have to attack it several different ways. One is definitely getting rid of this sodomy law, which criminalizes sex between men. So if you're going to do effective prevention for the population most affected by AIDS in Jamaica, you would have to actually talk about the kind of sex that they engage in. And you can't do that because that kind of sex is against the law.
And in terms of the big picture, in Jamaica and in other parts of the Caribbean, do you think that in the discussion of HIV and AIDS that we're moving away from treatment to prevention or not?
Well, I think the Caribbean is a perfect example of why we have to do both. So let's look at treatment for a second. Jamaica has 43% coverage rate. So the 43% of the people who need AIDS treatment to extend their lives right now are getting it. Then if you look at the prevention picture overall in the Caribbean, for every 5 people put on treatment, 10 are newly infected. So we're swimming against the tide. And when you and it's my opinion, and I think the growing understanding in the AIDS movement, that if you want to effectively deal with prevention, you have to deal with the concentrated epidemics among men who have sex with men and sex workers and in some regions, drug users.
Right, and so these trends that you're talking about in Jamaica, do they also reflect a pattern in other parts of the Caribbean, or is it too much to generalize? I mean, as far as that you can generalize, what would you say is going on?
They absolutely reflect a trend. I mean, if you look at Trinidad and Tobago, the prevalence rate is 1.5 in the general population, and it's 20% among men who have sex with men. In the Dominican Republic, for instance, where there isn't a sodomy law, I believe the general prevalence rate is 1.1, and it is 11% in the gay population. So it's less of a divide, and maybe that speaks about the criminalization of gay men's lives, but the trends are absolutely across the board similar.
And in terms of Jamaica's anti-sodomy laws, they would say, you know, why is Jamaica always having, the finger is always being pointed at us? There are other countries around the world who also have anti-sodomy laws. What would you say to them?
I would say that's true. I think there are 80 countries around the world with sodomy laws or some kind of laws that criminalize relationships between men or relationships between women and women. And I think that's really important. Look at the United States. It was only in 2003 that a Supreme Court ruling essentially nullified all of the state sodomy laws. So that's true, but I think it's also important, and I would point to the recent Human Rights Watch report on the militia-sponsored attacks against gay men in Iraq that would make your blood turn cold to read these reports. So it's a problem all over the world, absolutely. But the quality of the violence in Jamaica is quite stark. In fact, there are immigration lawyers here in the U.S. working with asylum seekers from Jamaica, and they say across the board the quality of the attacks are extreme, and in fact it makes it easier for them to win cases because of the nature of the violence perpetrated against the gay community there.
Right. Is there something that, I mean, some insight that you can give us into why this culture of homophobia is so pervasive in Jamaica, say, compared to other parts of the world? I mean, are there cultural factors that make it that way?
The story that is important to understand and tell, but it's really difficult to face in Jamaica, is that the prevalence is so high in the gay community and stigma is so strong that gay men are getting married or having female partners, and there's acting as a bridging population to the heterosexual community, and specifically women, and that's not something that's discussed. It's a very difficult issue to discuss, again, because of the culture of homophobia, but also because it feeds into homophobia. So then the homophobic elements in the culture can say, see, these gay men are infecting our innocent women, and obviously that's not the picture.
And what role is Jamaica's government playing? Could it be doing more? Is it doing what it can do with the money that it has and the resources that it has available within its sort of wider sort of healthcare budget?
Right, well, I'll break it down again between the government and the Ministry of Health. So the government has said some terrible things about how they'll never repeal the sodomy law, how the Prime Minister has said that he will never have a gay man in his cabinet. So there is a lot being done at the highest levels of government to fuel homophobia, and when homophobia is fueled, you're not going to, again, contain the AIDS crisis. The Ministry of Health is another story. They've recognized that they're not going to get their job done unless they deal with the epidemic among men who have sex with men. So they've begun, again, if I might refer to one of the World Focus segments, the former head of the National AIDS Control Program said it would be good if we repealed the sodomy law, and that the entire government and the Ministry of Health needs to understand that they've failed when it comes to prevention.
Right. Is it a political issue for the Jamaican government that they don't want to decriminalize or repeal the sodomy law, or is it more to do with this culture of homophobia, which you've been describing?
I mean, I think it's really integrated and complex. I think it's a political issue because it really is ingrained in the culture and the society, and there would not be popular support for such a move.
Give us a sense of what Jamaica has done, the kind of progress that it has made, and give us some context about the antiretroviral drugs which have been provided by Jamaica, which are free, whether they are accessed or not accessed by individuals.
I mean, there's been an uptake, there's been an increase in the uptake of antiretroviral drugs in Jamaica, and it's fantastic that they're given for free. They are now achieving 43% coverage of people who need the treatments. But it's important to state that the global community, the heads of state, the UN, have all said that universal access must be achieved by 2010. We're about a third of the way there, and Jamaica's only a little bit ahead of the curve.
And is Jamaica unique in using community liaison groups and individuals like Ida, the woman that we saw in our film, in terms of educating communities and trying to reduce the stigma around HIV and AIDS?
I wouldn't say they're unique. I think it's been generally understood because of activism in the global AIDS advocacy community that communities have to be involved in every aspect of AIDS prevention and support. So governments are actually required to have communities involved in all of their programs. It seems to me that the Jamaica program is quite strong. The Parish AIDS Committee seem to be doing really good work. And you see communities adhering to their drug regimens and really absorbing prevention messages when they're working with community leaders such as Ida.
And give us some examples of the kind of grassroots campaigns that these activists are involved in, and can you share some of the strategies that they're using which perhaps you have or haven't worked, or you feel that you could make better?
To say grassroots campaigns is to overstate it, because the lesbian, gay, transgender community in Jamaica has to basically exist underground. Again, as one of the excellent segments that you aired shows, if you so much as embrace in public, you're at risk of being attacked by a mob. So the kind of work that the gay community is doing is is underground. It involves speaking out when the government or the church says something egregious about the lives of homosexuals and how they should be criminalized, how they are an abomination in the eyes of the Lord. So
what is the best way of tackling that?
Tackling that, I think one of the most important ways are finding leaders within the culture, in the church, in the communities that where you can find an opening, right, where they're willing at least to say that it is not okay to beat and kill gay people, and start working with them and seeing if they can begin to take a leadership role in making change.
So let's talk a little bit about how women are also being infected by these bridging populations and the way in which they access treatment. Is it sort of to do with, does it happen along gender lines that they have difficulty accessing treatment, or are they more stigmatized as a group if they become infected? What is the role of women in HIV and AIDS in Jamaica?
It's, again, another complex picture. When I was there last February, I had the opportunity to meet with a group of HIV-positive women at the office of an excellent organization called Jamaica AIDS Support. And these women, I have to say, after spending 10 years working in Sub-Saharan Africa, in some of the poorest communities in the world, there was no difference between the lives of these women and the lives of the women that I met in my work and my travels in Africa. The stigma is intense. The poverty is intense. They're not able to stay on their drugs for lack of food. They're not able to get to the clinics for lack of transportation.
Right. And what kind of role can these women play in helping to lessen the epidemic?
You know, I think I've talked to a lot of activists about this. How can we get the gay community and the women's rights community together talking about this issue? And it's not happening yet. It really needs to happen. There needs to be an understanding that both communities are affected. They're in it together.
There is also a culture of blame as well.
There's a culture of blame.
How do you get beyond those very, very emotional issues when, you know, a woman becomes infected by a man she thought was straight, and it turns out that he's bisexual or he's gay?
I mean, I don't.
How do you have these conversations?
I don't think those conversations, as far as I understand it, they may very well be happening at a personal level, but they're not happening at a national level or even an organizational level among the organizations that are working on this issue. It's really, really tough.
All right, Julia Greenberg, thank you very much for talking to us and giving us your insights.
Pleasure to be here. Thank you.